Thank you, Rick. And hello, everyone. I look forward to talking with you today about Lorain County's System of Care initiative for transitional age youth. And as you see the title, it's coined a work in progress. Let me just get this started here. Okay. Resume the slideshow. There we go. Can everyone see my screen okay? Yes. Okay. So Lorain County is one of two demonstration counties for the 5-year SAMHSA grant called the Ohio Healthy Transitions Project. And that is in partnership with Ohio Moss and Wingspan Care Group. And we just entered our 3rd year. It's hard to believe. We were so excited at this opportunity because for some time, we have a very robust system of care for children and a robust system of care for continuum of care for adults. And it seemed as though we were sort of patchworking and Band-Aid piecing together care plans for transitional age youth. And so this seemed like a great opportunity to really examine our current community system of care for transition age youth and to build an improved and coordinated system of services and supports for transitional age youth. For the purposes of the Ohio Healthy Transitions Project, Transitional Age Youth, as you will notice, the acronym TAY, which is Youth Approved, Youth Decided Upon acronym, ages 16 to 25. And in this project, all of the youth served have mental health, substance use, and or comorbid developmental disabilities. And so sort of the why, what we, as many of you experience and know, child serving systems have a different set of working principles and standards of practice than adult serving systems. And a child serving system, a young person connected in those systems are used to feeling very wrapped around and very supported. And there's a lot of nudging, and there's a guardian that is an advocate and a support. There are a lot of different safety nets that surround the young person that are protective factors that sort of help move them through that system. And on the adult serving side, the principles of care there are, for the most part, you access services on your own or you don't. And there's less nudging and less hand-holding and sort of less tailored support. And so, it's very likely that without a system of care dedicated and designed specifically for transition age youth, that as young people sort of start that bridging over to the adult world as they turn the arbitrary age of 18, that they may fall through the cracks and services may be interrupted, or there's not a mechanism for a seamless transition over into those adult serving systems. And so our hope is that through the OHTP project and our system of care change initiative, we will build a transitional age youth system that sits solidly right in between those two systems as a bridge. We also know that transitional age youth are their own unique subpopulation, and they need services that are designed specifically tailored to meet their needs and that are culturally competent, around their specific population needs. From our board's perspective, having an effective, seamless, uninterrupted, service provision, coordinated care mechanism is really behavioral health prevention and early intervention, right? So often when services are interrupted as young people are transitioning, they experience a myriad of psychosocial crises, housing instability, homelessness, legal involvement, food insecurity, and those types of psychosocial crises can exacerbate pre-existing mental health issues and behavioral health crises. So that is sort of, and we also know from a brain science perspective, as many of you on this call know, young people's brains, just from a developmental phase perspective, are not fully developed at 18. And so we really need to augment and tailor our service delivery and design around what young people need. And those young people who are in sort of that phase of brain development and have mental health issues are more likely to have some life functioning domain impairments as well. They may be more likely to have experienced various traumas and maybe have more compromised social relationships and struggles in education and career pathways. So our Lorain project is really, we set out to build these a direct care service. OHTP navigation services is sort of the direct care service. It's a TBS, CPST case management skill building service. And so that's one prong of our project is direct care. But then, and that's in that green bubble here. And then you see all of these other represented circles here. These are the other components that our local interagency partners have collectively identified and prioritized as components that are necessary for young people to flourish. So we wanted our system of care to really be examining and building and enhancing these other components that we believe are necessary for young people to thrive in our community. Housing and transportation is a critical need in Lorain County, and looking at how that's tailored specifically to transition age youth. Employment and education opportunities. We have identified and learned how important and critical transition age youth specific peer support is. And I know Michaela Lang is somewhere on our call today. And so Michaela, I invite you to chime in and interrupt me at any time to talk about your involvement on our project. We also collectively identify the need to build improved pathways for community connections. And this is a way for young people to feel connected and to have purpose in our community in new and innovative ways. And the other component is a community awareness campaign and toolkit. Community awareness is a critical piece of this work because we're really spreading the word that this population needs its own attention as a unique subpopulation. And so we're asking individual systems and community partners to really view this population through a new lens. And we're asking individual system partners and community stakeholders to build and develop new programs that are tweaked especially to these young people and to change their policies and organizational practices. And so we really need to sort of help educate the community about this population and their needs. And then that also includes a lot of, we're doing a lot of resourcing and resource development. And part of that is a toolkit and a really cool mobile app that we'll talk about in a bit. And then the last prioritized component is we are working to build transition age youth specific behavioral health teams. So, we don't want to expect a counselor who traditionally works with 40-year-old adults to also equally and passionately enjoy working with a 19-year-old and all the challenges that come along with helping a 19-year-old navigate sort of settling into adulthood. And so we're really working with some of our community providers around increasing their skill set, competencies, and building transition age youth niche behavioral health teams. So you can see here, we've got this direct care component. And then we also, as a part of that, the young people in OHTP do have access to a young adult coordinator. Right now that's Michaela for both counties. And if we could clone Michaela Lang, we would, and our community would be so much better off for it. And so we're really closely watching and gathering information and data around the impact of having a young adult coordinator, a youth peer support at intake and engagement, and how that impacts the young person's willingness to engage and get connected to services and the outcome across life domains. We've had a lot of success with having Michaela alongside treatment providers at the onset at intake. So then this system of care initiative is sort of all of those other domains that we had collectively prioritized as well. So I included this slide just to say that the change process is real, right? And so we're in the third year, and I especially focus on this gentleman in the middle stumbling because I like to honor like our stumbles. There's so much good information in our hiccups. And I think there's like a natural resistance to things not working the way we want, or I think there's also a natural resistance to like vulnerably sharing our deficits. But it's in all of those places where we fall, where we end up learning the most about ourselves and doing the best work. And so every time we have a hiccup, it illuminates all the things that we can, sort of have forward movement on. So we welcome our hiccups with thankfulness and excitement. So this next slide here. So the OHTP project is, has this evidence-supported practice model transition to independence process. It was recently added to the California Clearinghouse, and it's called the TIP model. And that's really the foundation and framework for the Ohio Healthy Transitions Project direct care services. And locally, we have an interagency committee of representatives on our steering committee that is really sort of guiding this work forward in our community. And we did start with making sure that each of those stakeholders on different levels administratively and on our steering committee know about this TIP model, because these, when you're doing system of care work and system change work, sometimes the waters get murky, and it's always helpful to have some principles, some pre-established collective principles that you all have agreed to rally around and commit to. And so the TIP model is sort of that guiding principle for us. I'm not going to read each individual one just out of knowing my 15 minutes is probably up. But, you're going to see things like young people, it focuses on relationship development, person-centered planning, focus on young people's future, really helping young people, empowering young people to become self-sufficient by walking alongside them and building on their strengths and connecting them to a safety net of supports. And most importantly here, ensuring there's access to a coordinated, appealing, I'll say that again, non-stigmatizing, developmentally appropriate continuum of services. I've learned so much from the transition age youth who sit on our planning committees. The things that I once thought were awesome marketing are not. And that's a really cool part of this project is the reciprocity. I'm not sure that the transition age youth realize how much I have gained from them. They're helping us build this system of care and helping us develop all these new services. And, they, as much as we're building a new system of care for them, like they have had such impact on each and every one of us. So there's reciprocity in that. And it's been really a cool thing to be a part of. So just a quick snapshot of how we're doing this work. We have a monthly steering committee. As I shared, it's an interagency cross-represented systems, partners and stakeholders. We identified some collective shared language through everyone being comfortable and aware of the TIP model. We defined collective shared vision for each of the prioritized components, and we have an active live working document each month that we're working on to track our action steps forward towards each identified component goal. We are a targeted action planning group, and we evaluate how those actions, what those outcomes are, and we pivot when we need to, and we have forward movement. The other part of this monthly group is we're really trying to, we do some data analysis individually on the OHTP project, but also of our system. We have learned that transition age youth data is very fragmented, and it's hard to tell it's like an invisible story that the transition age youth population is living, because it's hard to piece together data to really sort of demonstrate the need for transformative system change for young people. And as we enter into this third, fourth year of the grant, we are shifting into sustainability planning, and we really need, good data to justify. We're going to be asking, yes, the Mars board, and from a behavioral health perspective, we are committed to sustaining this work, but so many of the necessary components are also, we will need our community partners' support as well. We also have a general membership meeting quarterly, and this is our way of really linking the community to the work that we're doing. And so we meet monthly as like the steering committee to sort of target an action plan and sort of the hammer and nails doing the work. And then quarterly, we present to our community partners, and community partners that are in the general membership. They're really people who are stoked about transition age youth, and they have a passion for young people, but they don't feel ready to commit to a lot of task-oriented work. And this is a way for the community to really tune in to the conversation. It also keeps the conversation alive and breathing, right? Like the sort of from an advocacy perspective around changing and building our community to improve and support young people in new and different ways. So we bring to the attention of the general membership our work, and we ask for feedback, and we get advisement from them. And it also, it's partnership and networking. So it's really cool to see how what you'll hear is one very small change then sort of snowballs into a cascade of several other little changes. And so we use that quarterly general membership meeting to really keep community momentum around our system of care project. This is just a quick snapshot of the interagency representation. And we do have MOUs with a few of these partners. But you can see that there are, providers, lots of government entities, some grassroots support groups as well, and transition age youth are also represented on our steering committee. So this is just an example of some of the data that we track. This is data that is specific to the Direct Care Services OHTP project. We use this to inform our system of care development and decision making as we are sort of prioritizing all of those different components we're trying to build in the community. All right, so what we have learned, our key takeaways. So transition age youth voice is so important and critical at the planning, at every stage of the work. So at the planning table, at the feedback and evaluation table, they truly are experts of their own experience, and their viewpoints have been so enlightening for me personally, and how we sort of conceptualize the work we do. Transition age youth are 8 times more likely to end treatment early when compared to adults. And so that's really important information for us to know, sort of to increase engagement and increase utilization and connectedness. We really have to have a new and different approach. A young person's perception of the services and their past experiences together impacts their willingness to connect to services in the future. For us, housing instability and transportation is something we are actively working to creatively overcome. And this isn't just transportation to medical appointments, we as a community are examining how we can support young people in that first month of getting to work, right? As they're getting on their feet, how do we help as a community sustain that time period when you don't have access to public transportation? I mean, we have a very limited public transportation system. And so, like this transition age period is this opportunity where with the right opportunities and supports, you can launch a young person forward in all the right ways, or they can sort of veer in off the path. And so we're really looking at what are some of those social determinants of health, those ways that we can as a community support this population in new ways that we haven't in the past. The other part of that is that formal and traditional services are important, but we also have to focus on building access to informal and ancillary supports, and how do we create new pathways for young people to be connected as a young community and connected to our community at large. So some examples from our project, and I know I'm probably late on time here. So we have some different local funding through our Mars board to support transition sessions and coordination of care conversations and collateral contacts that are clinically necessary. We also have funded, we do fund some portions of the OHTP direct service, and we've made some changes to our policies around financial triaging and intake. An example of the policy changes we're looking to make and are doing with our partners at Wingspan now. For example, a young person may show up to services, to an intake, and not have any of the necessary documents that they need for an appropriate financial triage. And so, we want this to be as low barrier as possible. So we're asking, we've changed our policy around that practice, and young people are to be opened, start the engagement, start relationship building, and then don't forget about that paperwork, right? Like documentation is so important. So to help that young person understand, like, why do I need a driver's license? Why do I need my social security card? And how do I get my social security card? And so that OHTP professional will then walk alongside the young person and use that not as a barrier to turn them away from care and say, you need A, B, and C in order to enter a program, but to say, welcome to our program. Now let's get all the necessary things you need together, and really use it as a learning, teachable moment. So those are some of the shifts in thinking and organizational practice that we're asking our partners to make. The Mars board also, we have some local funding that is supporting a 2-year pilot project to help support building those pathways for community and connectedness. And we are excited to announce that we have Community of Hope in Lorain County. We just did our launch. We're recruiting volunteers. It's a volunteer adult mentorship program where we wrap 3 to 4 adult volunteers around one transitional age youth. And they commit to that young person for a minimum a year. But what we know is 98% of those communities last much beyond the 1-year mark. We have made some new mechanisms for referrals and data gathering with our coordinated entry system and shelter care. And we have also, with every community awareness campaign that we go out and do, people do get invited to be a part of our larger work groups. And through that, we've built some pathways and connectedness with our local community college. Right before COVID, we were working on co-locating an OHTP navigator and peer advocate in the community college on campus drop-in center. And so those are just a couple examples of, I could go on, but I know I'm short on time. So our future, we are working to really, these next 2 years, amplifying our Lorain transition age youth voice, solidly getting our transition age youth behavioral health teams in place and taking clients, improving our housing solutions. We are working with our landlords association to build a network of landlords who are willing to rent to our young people, without a cosigner, right? Like an 18 or 19-year-old a lot of times doesn't have a cosigner, but they need stable housing, and building some behavioral health supports with those sort of apartments, looking at how we can build improved shelter care and independent housing options for our transition age youth. And we're also looking at how we can increase community connectedness and take some of our Ohio Healthy Transitions youth and build a pathway to helping them become transition age youth peer supporters so that they can sort of give back to the young people in our community as well. And then our mobile app. But I know that I'm over. My little beeper has gone off and it's noon. So I'm going to cut myself off. Does anyone have any questions about our project and sort of the process we've undertaken and the struggles and the successes?